Welcome to Clinicals with Pharm Vic. Today we're learning about acetylcysteine. Acetylcysteine acts as a precursor for glutathione synthesis, binding to the reactive metabolite of paracetamol and reducing oxidative cell injury. It may also improve hepatic perfusion in established liver injury. Acetylcysteine is indicated for paracetamol overdose when there's a risk of hepatotoxicity. This includes cases where paracetamol concentration is above the nomogram threshold 4 to 8 hours post-overdose. Also, if the total ingested dose is over 200 milligrams per kilogram or 10 grams, especially with delayed presentation or modified release paracetamol. It's also used for repeated supratherapeutic ingestion. For multiple ingestions or modified release products, always seek toxicologist advice. Precautions include chronic alcohol misuse, very low protein diet, and asthma or anaphylactoid reactions to acetylcysteine. Current treatment with certain enzyme inducers like isoniazid or carbamazepine may reduce glutathione stores, requiring a lower treatment threshold. In pregnancy, benefits generally outweigh risks with limited clinical experience showing no adverse fetal effects. Acetylcysteine is safe to use during breastfeeding. Mild to moderate anaphylactoid reactions like flushing or urticaria are very common, occurring in over 10% of patients. Severe reactions are common, about 1%, especially with rapid 1-hour loading dose infusions. Giving the initial dose as a 4-hour infusion can reduce the frequency of both mild and severe reactions. Acetylcysteine dosage for adults is calculated using actual weight up to 110 kilograms. For potentially hepatotoxic overdose, the initial dose is 200 milligrams per kilogram in 500 milliliters intravenous fluid over 4 hours. This is followed by 100 milligrams per kilogram in 1 liter intravenous fluid over 16 hours, totaling 300 milligrams per kilogram over 20 hours. For higher risk situations, the follow-up dose is 200 milligrams per kilogram in 1 liter over 16 hours, for a total of 400 milligrams per kilogram over 20 hours. Children receive the same milligrams per kilogram dosages but with reduced fluid volumes to avoid overload. For example, the initial 200 milligrams per kilogram dose is given in 7 milliliters per kilogram of fluid, up to 500 milliliters. Practice points include starting acetylcysteine up to 8 hours post-overdose, as earlier administration offers no benefit. To prevent adverse effects, calculate initial doses carefully and ensure they are given over 4 hours. Slow down or stop the infusion if an anaphylactoid reaction occurs, and antihistamines may help. If IV access is impossible, acetylcysteine may be given orally. Seek advice from a poisons information center. Prolonged acetylcysteine may be required if alanine aminotransferase is elevated and increasing, or if paracetamol concentration remains high. For complex situations like very large overdoses or modified release paracetamol, always seek advice from a poisons information center. This concludes today's lesson. Share this video, like, and subscribe to my YouTube channel, Clinicals with Pharm Vic. Also, follow me on Instagram and Facebook at Clinicals with Pharm Vic. Let us grow together, learn, study, and revise.